Does it seem like with every passing day, week, month, or year, there's another ache, ailment, or health concern you have to try to figure out? Well, perhaps it's something that it's just irking you.
Something you'd just love to have a little insight on, but not necessarily a full-blown one-on-one with the doc.
That's why we bring you Ask the Doc. We address any question, any topic while you remain anonymous. And we do it with help from TidalHealth's Chief Quality Officer, Dr. Chris Snyder. Welcome to Historic Studio D.
Good to be back.
How you doing?
It's been a while since we've seen you.
I know, been hiding.
All right, so we've got you here. So before we address the questions, I have a question for you. COVID, does it seem like we're through it? We're reaching the end of the pandemic?
I think we're definitely at the best place we've been at since March 20th of 20. So, so it's a good thing. Numbers are down, and it's feeling different. So I don't know what the difference is. Omicron kind of was really aggressive. So just hoping that we have some natural immunity and people are getting vaccinated and doing the right things. So I think we're catching up. So, but we still have a few in the house, but boy, what a relief.
Yeah.
Better. Do you think there's a big takeaway from the pandemic?
Yeah, there's a lot we don't know. That's probably my first one. But I mean, I think, you know, the teamwork that came out of all this, we talk about it regularly at the hospital, just the community and how everybody came together was pretty amazing.
It's unbelievable. Longest 2 years ever, right?
It's been a long 2 years.
All right, well, we have a lot of questions today, so we need to get to those. First up, is there some type of medical condition that would lead me to always feeling cold?
There are endocrine conditions. Diabetes is one, thyroid disease. There's a number of things that, you know, cold hand, cold feet, warm heart though, usually.
Yeah.
Absolutely. So, you know, it's one of those things where if the temperature core is okay, the extremities just need to be protected. You also have other vascular diseases that can cause it. One's called Raynaud's. A lot of people have where their fingers change colors. We're not sure why those occur, but we do know that they are related to your vessels, blood vessels, clamping down a bit, and can be triggered by cold water, can be triggered by, so finding the triggers I think are key.
It's always a good thing to have. Okay, what can cause my fingers to swell to the point that I can't even wear my rings?
Yeah, so swelling in the hands can come from a lot of things. Breast cancer patients, for example, they have swelling after they've had surgery. But hand swelling can come from dietary things too. Too much salt. Some pharmaceuticals can cause swelling too. So there's a lot of different things. So swelling that persists for more than 3 days should probably be looked at by somebody.
All right. Next question. I'm having an awful time sleeping through the night. 2 prescriptions for sleep aids later, and I'm still waking up at 3 o'clock on the dot every morning. Help.
Well, I'm not kidding. Did my wife send that in? That's the truth. Women in general have problems with sleeping. We don't know why. We blame hormones, of course. But it's very difficult. There are men with insomnia too. Sometimes the pill's not the concern. Sometimes it's activity during the day that may be interrupting that. It could be dietary, again. Caffeine, for example, you got to watch. So there's certain foods like chocolate that has caffeine. Sorry, Jimmy. Unfortunately. But there are things that can keep you up at night. So you got to look at what you're putting in your body first. You know, if it gets persistent and lasting a couple weeks, even with the pharmaceuticals, sometimes we'll actually do sleep studies because it can be a respiratory problem at night that's waking you up, or cardiovascular too. So there's a lot of reasons. It's not a simple, straightforward answer, but the easiest thing to do is look at what you're putting in your mouth first.
Yeah, because some people are more sensitive to caffeine than others, right?
Absolutely, yeah. Especially if you're naive to it. You get a tolerance to it. That's why you tend to need more, just like any drug, unfortunately, that has that amphetamine type effect on you, where it increases heart rate, increases your awareness of things. So takes away our ADHD, but you know, caffeine definitely is one of the first places I would look.
Yeah, yeah.
So what I took away from all of that was make an informed decision before you put the chocolate bar down. So I love this one. Is laughter really the best medicine?
Absolutely. Haven't you ever had that good laugh? Your heart rate goes up, your belly laugh. I watch kids laugh, so I'm going to be a grandparent soon, so I'm really excited to see a baby come.
Congratulations.
But when they belly laugh, it's just like one of those, it actually just watching them laugh makes you feel better. So absolutely, yeah. You know, it definitely has physiologic change too. So it clears your brain, and you know, a good laugh really does, I think, have an impact on your overall well-being.
Laugh it up.
Yep.
Laugh it up. So have you got a moment to stick around?
Sure.
Okay, stick around here for just a second because we have got some more questions. We're going to take a quick break we'll be back in just a moment.
The doc is in the house this afternoon. We are getting some answers to random yet relevant health questions today with some help from TidalHealth's Chief Quality Officer, Dr. Chris Snyder. Let's get right to it. More questions. All right. Do you think it's safe to drink well water from the faucet?
It is. There's filters, and I know the well systems. The county actually, or most of the counties, I believe, have testing capabilities. So, you know, again, new wells require a certain amount of certification to use. But there are filtration devices you can use too, and I am not the one to ask about that. But there are bacteria that can grow in wells, and you really need to make sure your well water is clean. So using it out of the tap with the right filtration should be fine.
Should be okay. Okay. I usually don't get my hair cut because it seems like it never grows, so what's the point? Is there a point in life when a woman's hair just stops growing?
Yeah, alopecia is a technical name for baldness. So, and alopecia can be more common in men, obviously, but women can have alopecia. Again, there's chemical and endocrine reasons why, everything from diabetes to thyroid disease, again, where hair loss can be precipitate of the illness. So, so there are underlying conditions we look for with hair loss. Does it naturally stop growing? Yeah, in some people it does. Color change is more appropriate, unless you use Clairol. So, not looking at anybody on stage, but Jimmy and I have gray hair.
That's
so.
right.
I do too. I just hide mine.
But anyway, so yeah, absolutely, there's changes, and it does slow down and becomes more sparse. So the density of the hair definitely drops off with time. So you see it in women's eyebrows, you'll see it in women's facial hair, and then women also will grow facial hair as they get postmenopausal because of hormonal changes. So yeah, so there's a lot of, sorry, it's good to be a guy.
All those hormones.
Okay, sometimes I accidentally burn myself while pulling something out of the oven. I've heard that running cold water on the burn does not help. Is that true?
No, actually, when you have a thermal injury like that, you know, cooling it off, the quicker the better, reduces the amount of skin injury. Because remember, the thermal injury only goes to the point where that temperature creates cell damage. So by controlling that with ice, believe it or not, ice is probably the best thing. I don't know where they got butter from. Somebody told me about butter one time.
My mom.
Did you really?
Yeah, when I was a kid.
I'm really not sure what butter does because it really doesn't absorb anything. Maybe it's just the temperature change, I don't know. But ice is probably the best thing. So cooling the skin as quick as possible is probably the best way to prevent worsening of the burn.
Interesting. All right. And here's another one about water. Can drinking more water prevent headaches?
Most definitely, yeah. Low volume blood flow really will. Again, gravity, if you're standing up, water sits in your feet, right? So, and your body pumps it back up. So it can only keep up so much, but good hydration absolutely will prevent headaches as one of the symptoms. So you can get visual changes, all sorts of weird stuff.
How about that? Okay, so we are to the point of asking if you have a question. If you want an answer, all you have to do is send it to comments at delmarvalife.com, and yes, you will remain anonymous, we promise. TidalHealth's Dr. Chris Snyder, thank you so much for joining us today.
Thanks, great seeing
I
you.
learned a lot today.